and that is RevitalizeCDC. And we are joined today by Coleen Loveless, who will be on my right, and Ethel Griffin, who will be on my left. And I know we have 3 fans sitting in the back that are supporting, and we put the glass there so that you'll be protected from them. So if they throw anything at you, we'll know.
Okay.
All right. So first of all, I want to thank you for submitting a proposal. I want to thank you for your interest in trying to improve the health of our residents, and I will turn it over to you.
Well, Mayor and Alicia, thank you for having us today. I'm Coleen Loveless. I'm the president at Revitalize Community Development Corporation. We've been in existence in the city of Springfield since 1992, where we originated, starting off as a Rebuilding Together affiliate, and then in 2015 expanded outside of Springfield directly into Holyoke in 2015 when we became a community development corporation. Our focus has been making critical home repairs, modifications, and rehabilitation on the homes of low-income Americans with children, the elderly, military veterans, and people with special needs. Now, also in 2015, we expanded our program, started working with Bay State Medical Center, Bay State Health, and their accountable care organizations on a asthma home visiting and intervention program. This was through a technical assistance grant through the Green and Healthy Homes Initiative out of Baltimore, Maryland, which is a national network. And they were very instrumental in kicking off our DASH program. DASH is a doorway to an accessible, safe, and healthy home. So since that time, we've been working with, again, Bay State Medical Center, their accountable care organizations, and 2.5 years ago, Holyoke Medical Center asked us to begin working with them on an asthma home visiting program. So this program works with community health workers at the healthcare systems and our certified healthy homes assessors that go in and look for asthma triggers in the home, such as mold, pests. We provide education and supplies like air purifiers and air conditioners, which are really critical right now, as well as green cleaning supplies. So the goal is being able to help them control their asthma more so that they're not ending up at the primary care, the emergency department, or the hospital, and therefore the children are not missing school and the parents are not missing work. So it's a win-win situation all around. In the past year, a lot of our focus has expanded with our asthma patients to also address COVID. And we were the only nonprofit in Western Massachusetts accepting referrals from all of the healthcare systems, Behavioral Health Network, the Mental Health Association, Partners in Health that was contracted with the state for people who either were at risk of COVID or had contracted the virus, were under quarantine at home, or maybe had been exposed to the virus. So we were really instrumental in providing them safe and healthy home supplies to help prevent the spread to other family members, like the cleaning supplies, face masks, hand sanitizers, and then we discovered many were food insecure. So we were also picking up food from the local food banks and addressing that. So we served, just in the COVID program alone, over 2,000 households. Now, there were over 100 households right directly from the city of Holyoke. So this is really what our target is for this funding, that we would focus on those that we served with the COVID program, because we know that people of color and low-income individuals were disproportionately affected by COVID. They are also disproportionately affected with asthma as well. The city of Holyoke has a higher rate of asthma for children versus the state, with 25% versus 12% statewide. And also the people of color and low income, Latinos, are 5 times more likely to be hospitalized due to asthma, or 4 times more likely to enter the emergency department. We also have, with our DASH program, a seniors aging in place and trip and falls prevention, which 1 in 5 seniors each year have a serious injury, which is very costly and, of course, decreases their quality of life. With the asthma program the past year, in addition to the COVID program, we served 176 households with people that have asthma or COPD. And with this funding, we would really target and specifically focus on those families in Holyoke that we served with COVID. If the city would like us to open up to the general public in the city of Holyoke, we can be flexible to accommodate your needs and what you feel that the city would require. We have with me today our 3 staff people, Carmen Pagan, Chelsea McGrath, and Brenna Monroe. And they are all Healthy Homes certified. Carmen is also a bilingual community health worker, and they've also been certified in CAPS, which is a Certified Aging in Place Specialist. So we have the capacity, we have the experience. We've been partnering with Public Health Institute of Western Mass since 2015 on this program, and they would be supporting us as we expand. I'm going to leave with you today, too, a flyer of an example of how we would do this outreach in Holyoke and what the services would be provided. We would be looking at doing these repairs that eliminate trips and falls and asthma triggers, but also providing the critical supplies. Especially, we have found in the past with rental property, sometimes it's difficult. There's challenges working with landlords. However, with just providing the supplies like the air purifiers and the green cleaning solutions, we've seen an almost 30% improvement in their ability to control their asthma. So, and then they can also take that with them. So if they do move from that particular rental unit, they do have those supplies to still continue to use. So that is our application. In a nutshell, we would serve about 25 to 35 households as our goal. And if we receive more funding, we would be able to serve more individuals. If we receive less funding, most likely we would serve less individuals. We do have supporting funding with this program. We can still accept our referrals from Holyoke Medical Center. We can open it up to the Holyoke ACO as well. And really, that's what our focus in our application is. And we're really honored that you reviewed that, and be happy to open it up to any questions you may have.
Okay, first of all, thank you for submitting a proposal. Thank you for offering solutions or improvements in terms of people's quality of life. And so let me ask you a few other things. It looks like that based on we've got about 3,000 per household that we're talking in terms of providing intervention, trying to provide supplies, and correct me if I'm wrong here, but
Yes.
You're just getting the permission of the tenant in most cases. I'm assuming it's mostly tenants to be able to go into their apartment. We're not dealing with the landlords in this particular case.
Right. So we generally have accepted the referrals, patients from the hospitals, the medical centers, and they give permission for us to enter the household, to work with them, and provide the education and provide the work. Now, if it's much more extensive work, like for instance, sometimes we would like to remove carpeting and replace that with a flooring, so to eliminate the dust.
Yep.
That would require landlord approval. If not, we do have a HEPA vacuum. We have some other alternatives that we're able to provide for the family to still improve their quality of health.
Okay. So, and without obviously any confidentiality problems here, so have you found that you are in the same building with multiple tenants, or are you in a building and you got this is one tenant in this building, one tenant in the next building, or is there, I mean, I know statistically, we are in very heavy density in terms of at least asthma cases, and I also met with a doctor from Holyoke Health Center who also told me the COPD was significant in the lower sections as well. So have you found that it's consistent throughout a building and not just within the apartment, or are you finding by doing the apartment it really has a tremendous impact, positive impact on health?
So that's a complicated question.
That's what I like to ask.
So we currently have been accepting referrals strictly from the health centers. So Matt Holyoke, Bay State, Mercy, and they are sending us really, really difficult cases, people that are chronic users of the emergency department or have been admitted to the hospital because of their asthma or COPD. So they're only focused on that particular patient. Okay, so if they're in a multi-unit building, those other tenants might not go to Holyoke Medical Center. Maybe they go to Bay State or vice versa.
Right.
So we don't get that information. So we are opening up our system to go through 413 CARES, and this is with the Public Health Institute, so people can self-refer, and then we can to do an intake from there, and then be able to qualify individuals. So then we can look at clusters for that particular reason.
Okay, and I'm going to make a suggestion. Should you get funding, and even if you don't get funding, I'm going to make this suggestion anyway, that you contact the Holyoke School Department and see if they can help you identify students that are consistently missing school, primarily because of asthma, and then hopefully we can reach out to those families and work to improve the apartment facility, if not the actual apartment building,
Sure.
the apartment that they live in, and at least reduce that negative impact on the students. But I know we have about a 20 to 25% absentee rate, with a significant portion of that caused by asthma. So, and again, long term, that's not good for the student. It's not good for the community. It's not good for our costs in healthcare.
Sure.
A variety of things. So I would encourage you to
Absolutely.
continue to reach out to them. And I can also tell you that we are working with UMass on a air quality project where we are actually trying to get outdoor and indoor air, and we work with several of our housing agencies to, even though we think they're doing a relatively good job, to see what the air quality in their apartment complex is. So we hopefully will have some more information there, and you might also look to partner with them.
With them, yes. And Sarita probably has information with the Public Health Institute. They have indoor and outdoor sensors and air quality measures that they have implemented, so we can also include them.
Okay, well, that sounds good. So you got about 2 minutes? 3 minutes.
3.
Oh, my.
Wow.
We could almost have popcorn.
I know.
So without violating confidentiality, I'm assuming much of your work in Holyoke has been in the Flats, South Holyoke, Churchill, and
Yes.
up in the downtown area? Is
Yes,
that correct?
definitely. Yeah, the flats in downtown, that area, yes.
Yeah, okay. And I know you're not being referred to landlords, and I keep wanting to get landlords involved in this, so I hope landlords are listening. I mean, we would love to be able to clean up air in the building so that all of the tenants would be benefiting, and not necessarily the ones that have had acute cases in the hospital. So,
Right.
So landlords, if you're listening, please consider talking to us.
Right.
We'd love to help you make your building safer for your tenants.
Right. So when they're able to receive these services at no charge, and it's a win-win for the client, the patient, and also the landlord.
Yep.
So, there have been some challenges. There have been some landlords that have been stellar and really cooperative, and but then there are others that have challenges, and they're afraid of code enforcement and other things that need to be addressed.
Okay. Now, in the COPD cases, is that also air quality that you're really working on there, or is it slightly
Primarily,
different?
a lot of the elderly or the seniors with COPD, it was just some funding that we received from Health New England. A lot have been homeowners, so we've really had a lot of more opportunity to be able to do those interventions and repairs and
Within their own home.
right. So because you don't have that obstacle to
Right.
overcome, so it's quicker, it's more efficient, and we're able to.
And are those also referred by the hospitals?
Yes.
Okay. Okay. And so if we were in a position to expand this, and we could make an automatic connection, if you will, for people that feel like they're having health issues, would that be a negative or a positive for you? Well, you got to wrap up. Last answer.
I want to make sure I understand the question. So if you have a senior and you're referring.
If we were to open up the dialogue and make this more out there public promotion rather than through the hospitals,
Right.
Would that be a problem for you?
No, that would streamline the process a lot more because they have really strict guidelines on how they refer people. So if we can open it up to say, because that's why I said the general public, I'd like to open it up to anyone with the diagnosis of asthma or COPD.
Okay. Okay. Thank you very much.
Thank you very much
Thank you
for
all
having
for coming.
us.
We appreciate what you're trying to do. I certainly appreciate the impact you can have on people's lives. So,
Well, thank
as you go along, if there's any other issues you have, feel free to contact myself or Alicia, and we will gladly talk and see what we can do. And we're hoping to make this. I was originally hoping to do it in August, but I'm thinking now it's probably going to be September. But I would love to get it moving. And let me ask that. I can't ask it. I've got to be fair. I can't give you more than 15 minutes. You're
Yeah.
out of here.
All right. We appreciate your
Thank
time.
you very much.
so
So I do appreciate it. I appreciate you coming on short notice. I just wanted the public to have a chance to hear what you're offering.
Great. Thank you.